Again, Assalamu alaikum and welcome all. Some of us that watched the cricket match between Pakistan and England this morning. Someone wrote to me that they always make our heart skip. The same thing happened to us just half an hour ago. It's such a pleasant surprise. We were expecting less than the number we have, but here you show, and I cannot tell you that if I was young or maybe if I was at home, I would be crying. Thank you all. We'll play one of the Indus Hospital slides. We all know that we have come together here for the devastating flood in Pakistan. If you have not seen the pictures, please go and watch on YouTube. I'm pretty sure all of us have used the cell phone now. Watch it, and I know all of you will be looking inside your heart and saying, I can do something for them. And that's why we have come here today. Just to give you a background of what Indus Hospital is. Indus Hospital is trying to change the paradigm of healthcare in Pakistan. Healthcare, as I used to know about 35 years ago that I left, was a lot of the care was provided by government hospital, but slowly that is disappearing or is not in good health itself. So if you look at more than 50% of the people in Pakistan have no access to basic health care. Some of you may not understand what basic health care is. Basic health care is just going to the primary care for cough, chest pain, and things like that. So they don't even have that. And we are just talking about adults. Think about the mothers and kids. They even have less care than the adults. So you see the numbers, it's disheartening that 57 out of 1,000 newborns die at birth. In the United States, it's less than 3 or 4. And correct me if there is any pediatrician. More than 40% of the people are living below poverty. And after these floods, you can understand the numbers will go. We don't want to go too high, and that's why we are here today. And if you look at the mother died during the childbirth, we still about 30 years back. Instead of going forward, we are going backwards. I used to remember the almost same number about 30 years ago. So this is the vision that Indus Hospital has. An excellence-driven, comprehensive, compassionate, free of charge. That's the key, free of charge. No one is charged when they come to Indus Hospital, whether you have credit card, whether you have insurance, or you have no insurance. There is no charge. And that is what Indus Hospital is trying to replicate all over Pakistan. If you look at this pyramid, so Indus Hospital is trying to start in the bottom and go to the top, which is the tertiary care. So they have some of the community health centers. They have about 20 community health centers, 14 are working, and then there are others coming up. We have mobile vans, which is one. There are board clinic, which is one, but there are several which are in the working. This is just a beginning which Indus Hospital started more than 20-25 years ago. but with our help, this should improve. So one thing again I see it that there is typo. This should not be indiscriminate, it should be non-discrimination. So providing treatment to respective age, gender, caste or creed. And it is accessible to everyone, cashless, paperless and accessible to everyone in Pakistan. Mainly in some of the southern Punjab, Sindh and Karachi. So there are 13 hospitals working under Indus Health Network. Of this, the main Indus hospital is in Karachi, and another one is coming up in Multan, Muzaffargarh, Bom, and then we have hospital in Lahore, and there are other hospitals also, as you see on the slide. One of the lacking part of Pakistan medical care is that once the patient has the surgery or medical care, they don't have any other rehab after they have left the house. So rehabilitation is so important for the complete care of the patient that is lacking. And Indus Hospital is trying to make up or at least trying to do some of those. And there are 4 rehabilitation centers in Pakistan. So what is the operational budget? This is from last year, $150 million. This is, I've been told, for mostly around Karachi and Sindh. In Lahore, they are putting up another hospital and they are expecting $15 to $25 million operation budget there. So about 5.5 million patients benefit per year. More than 70% of them are Zakat eligible. So you can understand how much needy people, patients are coming to this hospital every day. And I have been there. I will share one story. And my kids were there in this hospital. One of the mother of the kid who was diagnosed with acute leukemia. Some of you may not know, acute leukemia is a condition if you don't treat, they die within a few days. But if they are treated, these kids, more than 90% of the time, they are cured. The mother, when she heard that the son is going to get cured, even though she didn't know, she was trying to kiss my hand. You can understand how much appreciated they are. So there is so much work to do. One of the first things that some of you know, Dr. Bari is the one who started this, was the start of the blood bank. In 1979, 1980, there was the first blood bank that was created in Karachi Civil Hospital. And I came there and started my medicine in 1980. And we could see that there are, unfortunately, drug addicts lying outside the hospital who were donating blood. They were not donating blood once every 3 months as it is prescribed for an adult healthy person. They were donating once a week, sometimes twice a week. Why? Because they were paying. They were paid money. At least that part has not completely gone, but minimized much because of the intervention like Indus Hospital and some other blood bank that has come up in Pakistan. I saw one of this person without a leg in Pakistan. You can understand how much we have gone forward in the Western country. A person without a leg or without legs can put on a prosthesis and can jog and walk and even participate in some of the tournaments. I've seen that, you may have seen that. So Indus Hospital is trying to change that people who lose their leg have some prosthesis to work with, to be part of their family, to help their family. So these are the primary care programs that in this hospital that I've already discussed with you. We have primary care health, maternity and child health, a board clinic, and then there is one more part that I've been told that there are 5 or 6 container clinics. So there is not enough money to build an actual mobile clinic or actual solid foundation. So we have some container clinics. So this is what I have been talking about. You have to have a family medicine, public health to provide the best care, or at least the minimal care for the patients in our part of the world. We have talked a little too much about negativity, but there is always positivity, and that's what I see in this room today. We will see some positivity today, inshallah. So it is expanding to serve. Indus Hospital is coming up with a 1,350 bed facility in Karachi, and I have seen this building almost a year, 2 years ago, 1 year ago. It's going to start operating in next year, starting with about 100 patients, and it will gradually go up to the maximum of that 1,350 is that we are planning to do. So we need so much for this facility too. And this is the final picture of this. So we have some of the nursing, medical health, allied health, physical rehabilitation that is going on, and they are getting trained and they're getting prepared for Indus Hospital. So it's a corporate structure. 18 members of general body, 11 trustees, and I have a member of the board here. I can tell you, none of these board members are paid. Whatever they do, wherever they travel, wherever they stay, it comes out from their pocket. Is that right, Mr. Paracha? Mr. Paracha is here and he's saying yes. I think we should commend them for that. Thank you, Mr. Paracha. So, Pakistan being a poor country, you can see, I've been told 90%, here it shows 86%, 90% of the funds are provided by the people in Pakistan. So you can see how generous they are. And we want to see that generosity here today. So we have come here today for the emergency flood relief appeal. Before we do that, I just want to ask Dr. Magda to come and present his 2 minutes because he was there in Indus Hospital and he will share some slides with you.